All right, Sherry, thanks for being with us, and I'll hand it over to you.
All right, thank you. Well, welcome everyone. As she mentioned, I am the rehab director here at City of Hope, where I have been now 17 years. And so in my practice, I have developed a lot of programs geared towards the needs of our patients, whether they're in active treatment or in remission. One of those programs being our sexuality program. And I started this because I noticed there was just a strong need across the organization for patients in all phases and all stages of their care, no matter what kind of cancer. There were different concerns around sexuality, whether that's things like engaging in sex, whether it's how you feel in your body, how you feel when you look in the mirror, how you connect to your partner, the ability to be intimate. So unfortunately, cancer and its treatments affect every aspect of sexuality. So my goal today is to review what are those ways that cancer and its treatments can impact sexuality in all of those domains. And then we're going to talk about what can you do about some of those common issues that come up. I am going to hold questions till the very end, just so that we have time to review the content. And oftentimes there are questions that I do cover later on in the presentation. I am going to touch upon ways that it affects male sexuality, but at the end, if there are more questions about male concerns specifically, I'm happy to answer those or actually bring back some of the slides that I have. So diving right in, I started off by kind of defining sexuality. And it's hard because when people hear sexuality, they just think of the word sex. They think that that's what it involves, just the act of sex, when actually that's a broader there's a broader definition. And so it's a state of mind. It's how we feel about ourselves and others, including sexual functioning, body image, appearance, gender roles, identity. So there's a lot wrapped into sexuality, even outside the act of sex, which is really important so that we open up that kind of bigger conversation. Sexual expression is not just sex, right? There's different forms of sexual expression, whether that's touching or masturbation or spending time together. The act of intercourse, feeling attractive, flirting, dating. There's different ways that we express our sexuality, even if you're not sexually active, or even if you're not interested in having penetrative sex. Like there's different components of this that are impacted, unfortunately, by cancer and its treatments. So why is this even important? Sex in and of itself, that aspect of sexuality does provide tension release, emotional healing, a sort of connectedness to other people, so that reduces loneliness, a sense of belonging. This is an inherent part of being human and part of our wiring. So things like self-esteem and identity and just general physical fitness is a benefit of all of this as well. So sometimes in oncology, you might hear like, oh, it's not a priority right now, or it's just about survival, or it's just about getting this cured, and not really focusing on all of these ways that can be sort of impacted by cancer. So now I'm going to go through the larger treatments that we do in cancer and how that can affect sexuality. So this isn't a comprehensive list of all the side effects of these treatments, but specifically those things that might influence sexuality. So any type of surgery, right? It could be removing or altering sexual organs. That could be the breast, it could be the uterus, it could be anything around the testes or the penis. It could be any of these organs that are associated with thoughts of sexual identity. You could have decreased sensation, like that numbness, a tingling, painful sensation if nerves have been cut. Any sort of reconstructive surgery, whether that's breast reconstruction or reconstruction using a flap and other parts of the body, that could cause a lot of pain or discomfort. Limited movement from surgery can have an impact on sexuality. Swelling in different areas, whether that's in the arms or the legs or in the feet or the ankles. Urinary incontinence, unfortunately, is a consequence of a lot of surgeries. So that obviously will impact sexual identity and sexual self. Erectile dysfunction. So that's, again, not a comprehensive list, but these are some of the ways that are significant to impact sexuality and just the act of sex. And so if we look over at radiation, we know that can cause skin changes, overall fatigue, kind of just feeling too tired to engage in sex, or feeling like you're not really normal self of having the energy to do those kinds of things, sensation changes, tightness, which can also lead to limited movement. That obviously can have a negative impact. Chemotherapy comes with a slew of side effects, unfortunately. So you can have
Enter your meeting ID followed by pound.
You can have vaginal or yeast infections, difficulty having or maintaining an erection, changes in ejaculation, temporary or permanent infertility. We won't have that much time today to go into fertility. That's a whole other topic, but unfortunately that can be a consequence of chemo. Ports, catheters, tubes can negatively influence how you feel in your body and engaging in sexual activity. Decreased libido, which means you just don't have the desire, which is a common report during and after treatment. Like, I don't even feel like it. This is not really the priority. Irritability, trouble reaching orgasm or even having it at all. And then early menopausal symptoms like hot flashes, vaginal dryness, irregular or no periods. Like, all of these are things that unfortunately can happen from chemo that, yes, have a direct impact on sexuality. Immunotherapy, which is still kind of new, but a lot more people are getting immunotherapy. Similar symptoms that maybe I have listed before, but specific things like hair thinning, mouth sores, diarrhea is a common one, fatigue, nausea, and it's duplicated on here, unfortunately, but those are just some of the things that might be separate to immunotherapy, even though it might not be as toxic as chemotherapy. And then hormone therapy. So for some patients, they're on things that deprive of estrogen, or for men, they're on treatments that deprive them of testosterone. These are all the bag of goodies that come with that. And what I say a lot is, yes, we may have cured the cancer, but when you leave people on hormone therapy for years on end, just to keep the cancer from coming back, they're unfortunately struggling with a lot of these side effects from treatment. Things like hot flashes, night sweats, sleep disturbances, vaginal atrophy, which is like a thinning and a breakdown of the vaginal tissue that could cause a lot of irritation and tightness, vaginal dryness, changes in urinary frequency or incontinence, headaches. With males, they may experience an increase in breast tissue when they're deprived of testosterone, mood changes, skin and hair changes, weight gain, decreased libido, again, inability to achieve orgasms. Our estrogen and testosterone play a vital role in our ability to engage fully in sex. Again, infections, muscle pain, joint pain, and erectile dysfunction. These are all things that can be impacted by changes in hormone levels. And unfortunately, that kind of treatment approach can last for years. It's not necessarily short-term kind of effects. And so I just want to acknowledge and validate that either if you're on these hormonal suppression treatments or haven't had them in the past, or even just going through menopause, let's say we aren't even squashing estrogen. A lot of women just go through this in general because of just what aging does and going through menopause does. And it has a significant impact on sexuality and engagement in sex and sexual identity. So what are some of the psychosocial effects? We talked about the physical effects. So psychosocial things from just being diagnosed with cancer, going through treatment, even if you're in that phase of remission or being done with treatment, these are really significant side effects that impact sexuality, just stress in general, anxiety, psychological pain, the torment of going through such a traumatic experience and being disengaged from your identity and your roles and your routines. Body image and self-esteem plays a huge part in sexual engagement, especially these things that are not addressed as it relates to the satisfaction with sex and the quality of sex. A lot of times it's rooted in body image and self-esteem. Change in role is what I mean by this is maybe your identity was comprised of these very meaningful roles. It could be a mother or a father. It could be a teacher. It could be a soccer coach. It could be whatever you do for your profession. When you can't fulfill those roles, whether it could be just a role as a provider for the family, when you can't fulfill those roles, then there's a shift in identity that can start to happen. And that shift in identity can cause a spiraling effect to your self-esteem and not feeling like you're capable of accomplishing things and feeling worthy and even connected sexually. And then relationship changes. Unfortunately, cancer and its treatments take a toll on relationships, really, and a shift in dynamics of caregiver versus spouse versus partner, or a family member that has to take on a caregiving role. All of those things are a consequence of treatment that play a real part in this. So I just listed all the awful things that can happen, all the things that we do because of treatment. So now what can you do about it? So I'm not going to get into like a lot of detail. We have a short period of time, but I want to talk about some of the more common issues and what are some of the things you can do to address those. So I'm going to start off with something called dyspareunia. That's just a fancy word for saying painful or difficult sex. This is one of the most common reasons people are referred to me in my clinic. But understand that painful sex could be caused by a lot of things. So it's important, if you are experiencing this, to get it evaluated, because it could be something really basic, or it could be something more serious that we need to just evaluate further. So it's really, really important that we don't assume that it's one thing or another. I will say that one of the most common issues for women that causes painful sex is extreme vaginal dryness. This is menopausal symptoms that come up. I talked about vaginal atrophy, vaginal stenosis, vaginal dryness. And so that kind of discomfort from being really dry, and again, that's a result of decreased estrogen levels or the effects of chemotherapy, that can cause pain during sex because that area needs to be moisturized so that it's more comfortable. So because of the pain that people experience from intercourse, it causes, again, this cycle of it's painful, so I don't really want to do it. Okay, I'm losing interest in it because it's a negative experience. And so that just continues actually to cause more vaginal atrophy when people are not engaging in sex. So it's just a horrible cycle, right? So vaginal atrophy and lack of interest, that becomes exacerbated over time. So if it's not addressed early on, then things can get worse. And so what do we do about it? I go over a lot about different positioning strategies. You know, we are creatures of habits. Maybe there's the same one or two positions that you're used to, that you're comfortable with, or maybe your partner or person you're dating is comfortable with. But some of those positions can actually cause more pain than other positions. So really reviewing, well, let's try a different position because maybe that will put less stress on that area. Maybe it'll allow for less penetration than other positions. I always talk about the need for lubricants and moisturizers. We're going to go over the differences between those and how often to use them and which products in a second, but that's kind of a higher level of what we do to address these things. Device recommendations, stimulating that area. I'll go over all of these, and ultimately seeing a pelvic floor specialist might be the issue depending on the type of pain. So now going into moisturizers versus lubricants, right? So what is the difference between these? When should I use them? So again, this is addressing the vaginal dryness issue. So if you feel, and sometimes people tell me that it feels like a burning sensation when I'm having sex, it feels like a lot of friction. It feels almost like something's tearing. It almost feels like my partner just can't enter inside at all. Like it's kind of a hard stop. That's when we have to really start talking about these products. Now, lubricants are very different than moisturizers, vaginal moisturizers. You can't use lubricants without using some form of vaginal moisture. So you have to create a baseline vaginal moisture. And then whenever you put something inside of you, that's when you add lubricants, right? If you're not putting anything inside you, you don't need to use lubricants, right? That's during sexual activity, either with a device or with a partner. Anytime something goes inside of you, kind of like when you go for your gynecological exams and they use a speculum, they put lubricant on that. So whenever you put something inside, it causes a lot of friction, which needs a little bit extra moisture. So that's lubricants. Now the baseline vaginal moisture, that's just basically supporting the tissue of your vagina. You need that support. You need to ensure that it's moist, because then you can build upon that with things like lubricants. So one of these doesn't replace the other, okay? And now you know kind of when and how to use them. So when I start with vaginal moisture, I'm not talking about lubricants yet. I'm just talking about baseline vaginal moisture, right? I start with more conservative products, and then I get a little bit more liberal with the kind of stuff that's in the products, right? So here we recommend as first line, very conservative approach is pomegranate oil. And I know what you might think. You're like, where did we get pomegranate oil? Never even heard of pomegranate oil. But the thought process is this is hormone free, it's paraben free, alcohol free. When you think of things like olive oil and coconut oil, things that can be used in cooking, they tend to sneak in a lot of other junk in those products. So we've had things associated, like things like yeast infections associated with coconut oil. I'm not completely against them, but read the labels, right? You want it to be clear of chemicals. You're putting this in a very sensitive area. The thing about oils, things like pomegranate oils, you have to use a lot of it. You can't really use it once a day. You can't just put a little bit on. You have to use it 2 to 3 times a day. It's not compatible with condoms or latex, so keep that in mind. Now, when you apply things like oils, it's really important that you are liberal with it. You apply a lot of it, not just on the outside, but you also go on the inside as well. It's an opportunity to massage it into the tissue. It's an opportunity for you to stimulate blood flow by massaging the area. I always say, yes, it's 2 to 3 times a day, if not more, but you go to the bathroom that much, if not more. So keep it out, clean your hands, clean that area, and just put it on after. Put it on, after the shower, since you're already in the bathroom. Out of sight, out of mind. So keep it on the counter, keep it in your purse. Now this, I tell people to use it at least 3 to 4 weeks consistently, multiple times a day before you judge whether or not it's working. Okay. And if you are just using this, remember, anytime you put something inside, you have to add lubricants. Now, if someone tells me pomegranate oil, I tried it, I was consistent, it didn't work. And it's not a one size fits all. For some people, they use it consistently, it doesn't work. For others, they use it and that was all they needed. Okay. If it doesn't work, then I move to over the counter products. So these are things you might see in the store. You go into those aisles and there's tons of different products nowadays. If you go on the internet, there's a ton. I have images here. I don't fully endorse any of these 100%. I can't say this one is the one you should pick because I have learned with these products, everyone has a very different response. This is another one that's not one size fits all. Don't buy a lot of anything, just buy a little bit of some, see if you like it, try it out. Don't spend a lot of money. This isn't about like the more you spend, the more effective either. One of the ones we carry here is Reverie. It's a vaginal suppository that you insert into the vagina every 2 to 3 days. With vaginal moisturizers, the frequency tends to be every 2 to 3 days, which is a little bit easier than maybe the oil that I require multiple times a day. This one's every 2 to 3 days. You may have heard of like Replens. That was really popular. I've had a lot of patients who weren't too big on Replens. With some of these, they might feel a little bit messy at first. So I do suggest wearing a liner initially till you understand kind of how much your body absorbs the product. We've had some success with Gynotrop. That's another one you can buy online and just test it out, and see how you feel. The way to gauge whether or not any of these things are working is, are your baseline symptoms improving? Like, do you feel irritation down there? Like maybe you did when you were more dry, like if that subsided a little bit. But for a lot of people, the gauge is whether or not sex is comfortable, right? Or whether or not they can tolerate gynecological exams without a lot of pain. If you're not really interested in having sex, or you feel like your gynecological exams are fine, you just want to kind of support vaginal tissue health, it really is just a matter of, hey, when you go to apply again, does it feel as dry as it did before? You should feel some sustained effect. With these products too, you do want to give it a shot. Give it at least 3 to 4 weeks of using it consistently before you say whether or not it's working. So then lastly, if all else fails, right, that's when we introduce the discussion of vaginal estrogen creams. Now I understand there might be some of you on the call that have cancers that are fueled by estrogen, and there's a lot of taboo around using estrogen products in general in society. This kind of product does require a prescription. So this is a discussion you would have to have with your physician anyway in order to get these products. But for a lot of you, you don't have the estrogen in your body that's supporting the vaginal tissue. And some of you might be candidates for this type of prescription. I will say that this is a very effective product. I really don't have anyone where this did not work, because this is exactly what your tissue is missing. It's missing the estrogen. Now, this isn't something you swallow like a pill. So the effects on the system are not the same. You're not absorbing estrogen into your entire system. And research studies have shown that actually using vaginal estrogen creams or suppositories, things like this, have minimal absorption. And it is a discussion. And for some people, they're not comfortable, even if it is minimal. For some providers, they're not comfortable. We have providers here that do prescribe this, even to women who have breast cancer that's fueled by estrogen. It's a very personal decision. I just want you to know that these things exist, and that this is an option if other treatments have failed. I'll say that providers usually want their patients to try everything else first, which is why I reviewed all those other things before jumping to, using these estrogen creams. But if you don't have a breast cancer that's fueled by hormones, if you have other cancers, this might be a discussion actually to have sooner rather than later. All right, so we talked about vaginal moisturizers. Now we're talking about lubricants. So lubricants, I said, is if you're putting anything inside, whether it's a speculum, whether it's a vibrator, whether it's a dildo, whether it's a dilator, anything like that, it's good to add an extra layer, a buffer, so that you can minimize friction. Because whenever you put something inside, especially during the acts of sex, when there's a lot of movement happening, that's a really drying effect. It causes a lot of friction. And so I always tell people, use a lot of lubricant, right? We want to create a positive experience. And then later on, when you figure out your moisture level, then maybe you can taper down on the amount of lubricants. There are different lubricants out there. Again, that's another massive wall. When you go to the drugstore or the supermarket, or you go online, there's about 5 million of these. So again, I can't endorse like one brand fully. I just say, don't buy the family size, don't buy the Costco size, just buy a small one, see if you like it. Some people like some, other people don't like them, but the kind that we generally recommend is water-based lubricant. Okay, that one is safe. It's ideal for sensitive skin or vaginal irritation. So one of the ones we have here is Astroglide, but there are other water-based lubricants too. It is compatible with devices and toys. But the thing about water-based is it tends to absorb pretty quickly. So for some people, kind of during sex or during whatever activity they're doing, they feel dry again. So I always say you might have to reapply. Keep it close and reapply. The goal is to have a positive experience. It rectifies any negative experiences in your brain whenever you have a more positive one, right? So then the other kinds are silicone-based and oil-based. Silicone-based isn't bad. It lasts a little bit longer than water-based, but it is not compatible with silicone devices or toys, okay? And then the last category is oil-based. Again, that one's not compatible either. It does tend to last longer than water-based as well. All of this is a preference. Figure it out. And I don't want you to get discouraged if you try certain products and you feel like they're not effective, because this industry is not highly regulated. Anybody could create these products, right? These products are just out there, they're on the market, they claim whatever they want. And because of that, we don't have a lot of like, hey, we tested this one, if it works and this one doesn't. It's just trial and error with everybody. And all of us, and us, especially women, like, we have different balances, pH balance, our vaginal tissue is just all very different. So some people experience more dryness than others. And so we shift over to other issues that we encounter. What can we do about it? We talked about decreased libido being a consequence of chemotherapy. Just having cancer, your desire can go down. Hormone depletion was a really big one. But another thing to consider is increased cytokines. So these inflammatory molecules, when you're going through cancer, even when you're healing and in recovery, your body is really inflamed, right? Because you're constantly fighting things. Well, when your body's inflamed, and even if you don't relate it to cancer, think about having the common cold or feeling sick. You feel pretty fatigued. Sometimes you feel in a mental fog. You're probably not going to be really wanting to have sex when you're feeling that way, right? And so that happens a lot with the oncology population. And then the psychological factors that influence libido, things like stress and anxiety, your libido, your level of desire, your desire to want sex, to engage in sex is very sensitive to stress and anxiety or depressive thoughts or depression. Body image, I said, especially for men and women, how we feel in our skin, whether we feel like we are desirable, whether we feel attractive, whether we feel any sense of sexual identity, it's strongly linked to your desire for sex. And unfortunately, I see this all too common, even in the general population, not even just in cancer. The general population struggles with sex. I know it feels very isolating to go through cancer and its treatments, and to feel like these sexuality concerns are kind of a burden that comes with cancer. But I will tell you, the general population has a lot of issues around sex, and the numbers show it. There's a lot of sexual dysfunction in the general population, a lot of body image issues that cause, poor quality sex and poor libido. So I want you to know this stuff is normal and that you're not the only ones dealing with this. And so what do we do about libido? The first thing is you want to look at your medications. I will say I see this often. People on antidepressants for long periods of time, years they've been taking the same antidepressant, but actually a common side effect of that antidepressant is decreased libido. So that just might be something to review with your physician. Cardiac medications too, there's a few of those, not as common anymore. We've stopped using those types, but if you are on some cardiac medications, that can cause decreased libido. There's a lot of research that has linked people who exercise consistently have stronger libidos. I think a lot of it regulates some of the chemicals in your body when you exercise, but I do think there's a positive impact on body image when you exercise. Also, just increasing your sexual activity. So especially for females, because female orgasm and sexuality is very different than men, but for women, regular orgasms, right? When you have these positive sexual experiences, it actually feeds your sexual hunger, increases your libido. You ever notice the people that have a lot of sex just keep having a lot of sex, and the people that don't have a lot of sex just keep not having sex, right? And there's something to be said for that, right? When you are engaging in it often, as long as it's positive experience, I'm not referring to painful or negative experiences, your brain keeps wanting it. Your brain wants it more because it says, hey, I like that. It feels good. It has a positive physiological effect on you, which leads to an increased libido. So if you're out of the game completely, right, it's hard to get back in. But when you get back in and you create these experiences, whether it's by yourself, right, and there's a way to create positive experiences by yourself without even having a partner there. And if you want to reframe it, if you're uncomfortable with self-pleasuring, sometimes I just say it's for the sake of your vaginal tissue, the sake of your vaginal health. And for males, it's for the sake of penile health. There's something to be said for that too. Those types of experiences can create more positive experience when you are ready to have a partner involved. All right, let's see, sort of froze on me. There we go. Okay. So there are some people ask me, what about, drugs for this? I want a pill to make me have a stronger desire, and men get Viagra and all these things. What about women? There are things out there. The first one I want to reference is Wellbutrin. So there actually have been studies that, and Wellbutrin is an antidepressant. And you all may have heard that we use antidepressants for things outside of depression. Sometimes they're used to address like hot flashes, things like that. But there was a study that showed that Wellbutrin did have a positive impact on female libido. The only thing I have to say though is Wellbutrin is not compatible with tamoxifen. So if you're a breast cancer survivor and you're on tamoxifen, this doesn't go with that. That's the only thing. Other than that, it is a conversation to have with your physician if this is something you're curious about. There have been other products out there created for female libido. I cannot say I back any of these. The studies have not been the greatest quality. There hasn't been a lot of experience with these drugs yet, given the quality of the research, but I do want to just say these things exist. If you're curious, it is another discussion to have with your physician. Now, there's something to be said for just clitoral stimulation, right? And so I always tell women who come to me with a low desire, or women who unfortunately have lost their nipples during surgery, there's something to be said for the fact that your clitoris as a female, that's the motherland, that's the mecca of stimulation, right? Like we get a lot of sexual stimulation from the clitoris. The only time that should be impacted is if you had pelvic radiation, it may be impacted. Other than that, our treatments should not have an impact on clitoral sensation and stimulation. And contrary to how the media portrays it, most women have orgasms just through clitoral stimulation and not through penetrative sex. So it's this idea that every woman should just be able to have an orgasm during sex. That's not necessarily the case. It's actually through clitoral stimulation, whether that's using a vibrator or just someone's hand or during oral sex. These are the things that can provide orgasms. And I said the importance of an orgasm is it changes things physiologically, but it also increases your desire to do it. Vibrators are a way to increase stimulation overall, promoting blood flow, right? And just general arousal. It's been actually studied in certain populations, like multiple sclerosis. They did studies on clitoral stimulation and female satisfaction scores with sex and just general arousal level, and it had a really positive impact. When I talk about vibrators, you don't need to go get this massive vibrator, right? Because your clitoris is very, very small, right? And if we're just talking about clitoral stimulation, that's why I'm giving these examples. They're very small devices. And it doesn't need to be very intense. Every woman is very different, whether or not they want high intensity, low intensity. That is a very personal thing because some people are more sensitive than others. Some people, just even a little tiny vibration causes enough stimulation. For others, they need a stronger impact. Yes, you can go to stores that sell these and you can test out the different intensities. But I would just suggest if you are buying something online, buy one with variable speed so that you have options. And again, look at size. You don't really need a big one. Some women do like vibration during penetration, so something that you can put inside. That's a personal preference too. But if we are just talking about clitoral stimulation with that area, you don't need something large. And that area is one that has the highest rates of having the ability to have an orgasm with these things. So the other issue I mentioned was impaired sensation, whether that's due to surgery or radiation, or maybe something else happened and you have choppy sensation. For a lot of women, they tell me it's irritating when this area is touched. or it just causes a lot of like just discomfort. I kind of get the chills through my body, or it's just straight painful when someone touches a certain area of my body. This could also happen for men who remove certain organs, just certain parts of the body just doesn't feel the same anymore. And so I talk about like, yes, it might be areas that you use to get positive, you know, sexual experience from, like your nipples, but there's other areas of the body that can actually could create a positive sensation. So I talk about exploring your body alone before you engage with your partner, so you can understand what feels good, what feels kind of neutral, and what does not feel good, and communicating that with your partner so that those things don't happen during the act of sex, which can cause a lot of anxiety, a lot of distress, and kind of, again, not create that full positive experience you're hoping for. Communicating about this is key. The body mapping activity, again, it's the same thing I mentioned, like what feels good, what doesn't, what's irritating, and being able to communicate that. Ultimately, there are some desensitization techniques that you could try. It's basically your nerve endings might be like extra excited sometimes, right? And so it might get, it needs sometimes a way to numb them down, to dull them down. And so sometimes we have people take different textures, like brush different things to the area that has that irritation. Constant exposure to different textures can actually bring down the sensitivity of that area so that it's not as uncomfortable. And these images just kind of show all the areas that can be stimulated. The one above, it's the differences between stimulating when you're masturbating versus with a partner, which is really interesting how much more can get heightened when you're with someone else. And then the bottom ones are just like the areas that people have claimed to have like erogenous zones. For some people, they say, hey, it's my armpit. Actually, I had no idea there's something really erogenous about that. Or feet. It's just the opportunity to really explore and find out that maybe there are other areas than what was impaired by cancer in its treatment that might be arousing for you. And then I talked about the psychosocial issues, right? And for a lot of patients, they have so much anxiety about sex and about having pain during sex because it hurts so bad when they try, that even just the anticipation of that pain is just too much, right? And so that is something that can actually have a physical effect. And people don't realize this. When you're anxious about like, oh, the pain's gonna come, or the embarrassment is gonna come, or things like that, you can actually, especially women, tighten up that whole area. Like we have the ability to shut down the shop down there just by tightening up, right? And so a lot of it is about relaxing the pelvic floor, relaxing those muscles, and practicing that. Oftentimes I have, one of the activities I have my patients do is when they're really anxious is I have them use either a dilator or a vibrator, right? And I have them anticipate something going inside, but also rehearsing a lot of the muscle relaxation techniques as they're putting something inside. Because when you have a partner there, or you're kind of anticipating penetrative sex, that's almost too much pressure to incorporate these relaxation strategies. So if you can practice on your own, then you'll be ready with, you have a partner to kind of learn how to incorporate those things. I talk about guided imagery, deep breathing techniques, progressive muscle relaxation. If you're curious, YouTube is amazing. You type in pelvic floor relaxation, you type in guided imagery for pelvic floor relaxation, just deep breathing techniques. There's other sites that actually have things specific to cancer and sex, that it's the Epic Self. I think that's the website that I tend to use. And you go on there and they have a lot of different meditations and things like that, but they have some of these specific to the pelvic floor. And then ultimately, if you find that this is just too difficult to overcome, and understandably so, this is just a lot of things that have happened, either trauma in the past or just constant negative experiences, or just shame from things that have happened to your body that comes to play when you're with your partner. A lot of those things, you just benefit from talking it through with someone. And that's where clinical social work, psychology, like tapping into a therapist, an MFT, someone that can guide you through this, because it takes a village to overcome some of the things that cancer and its treatment does, and you shouldn't have to do it alone. All right, so then when we talk about body image, we talk about like how you feel when you look in the mirror, like how do you feel in your skin? You know, self-esteem, how we feel about ourselves. And again, this is the general population, not just people who go through cancer, directly impacts sexual activity. How you feel inside is 80% of the battle of getting to a better satisfaction with your sex life, and rebuilding that how you feel about yourself and your self-esteem, especially after what cancer does to you, rebuilding that takes time, but it's the key to feeling confident, right? And you've gone through a lot of changes in your body, positive and negative, or just different, or maybe stuff you feel neutral about, but those changes took a hit to your identity and how you feel about yourself. And of course, that will impact your sexual identity. And I talk a lot about this disconnect from your body. When you're diagnosed with cancer and you're going through cancer treatment, it's almost like you have to completely disassociate from your body, because that's a body that's coming out to get you, right? It's the body that you have no sense of control over anymore. You don't know what it's going to do the next day. You don't know if you're going to have these side effects the next day. You don't know if your cancer cells are going to spread. You don't know if the treatment's going to work. So if I can't trust the body that I live in, I'm going to disassociate from that. But sexual activity requires an extreme amount of connection to your body, almost so much so that it will bring up psychological things for you during the active sex. And so reconciling with that body that came to get you requires a lot of work, and it requires professional help oftentimes. And so if you can tap into it, or just tapping into some support system, because even just getting that validation, like, yes, I'm experiencing things, is the first step to healing. And you are not alone in all of this. But sometimes there's also the effect of, if you fake it, you might make it a little bit. And what I mean by this is I don't always recommend throw some lipstick on it, throw a wig on. But there's something to be said of, hey, I look in the mirror and maybe I'm not in sweatpants today, or maybe I don't have my hair pulled back for the millionth time, or there's something to be said when we kind of put a little bit more effort into our appearance, and we look in the mirror and go, wait, actually, it sometimes can shift a little bit, your body image, right? And you all might have experience, like you might be going to an event, you might be getting dressed up for a wedding, and you're looking in the mirror and you're like, wow, I still got it sometimes, right? And so that actually can have sort of a micro effect, because some people's body image issues are not as extreme as I mentioned. Maybe it is just like, I'm just frustrated with maybe how I feel lately, or maybe I just feel like I'm in the same rut. And COVID did this to a lot of people too. Why bother? Just, we're all at home anyway. And so I encourage you to explore other resources. The Look Good, Feel Better program, this is through the American Cancer Society. Incredible program, talks about different things. ACS also has the Wig Bank. The Beauty Bus Foundation is incredible. I know that the organization that you're all part of right now also has resources for all of this. So I just encourage you, if you're struggling to figure out how to manage any skin changes, if you're curious about different makeup recommendations, if you have no idea where to begin with a wig, if you're not sure, maybe you don't want to wear a wig, maybe you're just looking at other options, these organizations are really there to support you and to connect people that are going through those things. And so the last thing is, I just don't feel connected to my partner anymore, or I don't feel connected to other people anymore, or someone I used to feel really connected to. We had this amazing connection, and a partner I didn't complain about the relationship. Everything was fine, but wait, we just went through cancer and treatment, and now I just don't feel it anymore. And so the big thing I talk about is emotional intimacy. It's especially the component of mutual understanding. So when you share thoughts and feelings with someone and you feel like they get you, like they understand, or at least they can validate, like, I can't imagine what you're going through, but I get how that impacts you. It fosters a mutual understanding and support with each other, which then has an effect on your commitment to that person and your connection to that person. This is all a part of emotional intimacy. I've talked a lot about like physical intimacy and things like that, but without emotional intimacy, a lot of us can't really have pleasurable sex. A lot of us can't feel satisfied in our relationships, right? And this is outside of cancer too, right? This is just general relationships 101. And what I hear a lot from my patients is, I can't look at my partner the same way anymore because they didn't support me very well through the journey, or they didn't know how to support me, so they did poorly, or they just jumped ship. They just disappeared and they just really weren't there emotionally. I hear from their partner, I didn't know how to support them. I felt uncomfortable as their partner because I had to play this caregiver role, and I never felt good at it, and I never felt I could do it justice. And here what happens is just small little breaks in the relationship, right? And I feel like the journey of going through cancer is so isolating. It's so isolating that a lot of patients just subconsciously just distance themselves from a lot of people. good friends, even not just partners, like close friends in your life, you feel like they just don't get it, or their response to you about things is not very productive or helpful, even though they mean well. So why should I bother investing in those kinds of relationships, right? And so this just has this like micro effect that eventually, maybe even years later, you look back and you're like, I don't even know this person anymore. I don't feel like this is someone I want to be with anymore. All of this impacts sex. All of this impacts your sexual identity in the context of that relationship, right? And so because of this, like there are ways to address it, but for a lot of relationships, you need support, you need therapy, you need to have someone else guide you through some of these very difficult conversations, because one of the big things that I talk about is the difference in genders, right? Gender identification in intimacy, right? We don't give all of this a lot of credit, you know, and I'm not talking about like gender normative stuff, but all of us, based on societal influence, cultural influence, you know, family influence, we all have these ideas of gender and how we should kind of fulfill certain roles. And that could be very different, right? And so understanding it and defining it for yourself and having the other person define it, that's the first step to even expressing your wants and needs, you know, fostering what does connection mean for you? Because actually for me, it means this. What does intimacy mean for you? Because actually our definitions are, we're totally missing the mark, you know? And a lot of times in relationships, we make assumptions about what the other person's thinking or wanting or feeling, and we're really good at that. And then those assumptions just keep getting us into the same problems over and over again. So there's no way around good communication. And so I encourage people to really foster that connection by spending time with each other, getting out of your routines, having that isolated time to have these conversations, difficult or not. If you don't have the time to do them, they're just never going to happen. And then incorporating different couples activities. And some of these recommendations might seem more superficial than others because it just depends on the severity of the issues going on and the dynamic. For some people, it's just their routines are so off that they just never find the time to connect. And so I always tell people, like, sometimes you just have to schedule things and force it into your schedule, whether you like it or not, or it feels weird, or you don't like the lack of spontaneity in these activities. But we're creatures of habits, and breaking routines is one of the hardest things to do. And so looking forward and scheduling that might be an option. I always plug the love language, right? And a lot of you may have heard about this. This was a concept that started in the 90s. It like came back like a whole nother level, you know, over the past decade, but there's something to it. And the concept behind this is what I'm most passionate about, is what I mentioned. There's different ways we express love, and there's different ways we experience love. And so this concept is we all kind of fall into one of these 5 categories, but you and your partner might be totally missing the mark. Your partner might think that they're expressing love to you, but it's not how you receive love. Likewise, you might think you're expressing love to your partner. They're not receiving it at all because that's not the language they speak. So the different buckets are words of affirmation. These are things like, you know, like, I think you're incredible. You are beautiful. Like, I really am so proud of your accomplishments. Like literally words of affirmation. Some people, it's getting gifts or giving gifts, right? Others, it's acts of service. It might be things, small things around the house, or they went to go take the car to get an oil change, or just small things, maybe even taking out the trash. That's how you feel the love from the other person. Quality time, I mentioned, like, so important. Just spending time with someone might be how that person receives love or expresses love. And the last one is physical touch. And I don't necessarily, you can see that it's not labeled as sex, because for a lot of people, and there's science behind the positive experiences around touch, especially touch over 20 seconds, which we're all sort of lacking, especially in this COVID world that we live in. But for some, if they're not feeling touch, and unfortunately, when you go through cancer and its treatment, this is one that really takes a hit. It's people kind of pull back on how much they touch you or feel comfortable touching, and then that creates a huge sensory deprivation. But the concept behind this is you figure out how you receive love. Your partner figures out how do they receive love. And then you tell each other, I actually receive love when you do this or that. Because this person could be giving you all the gifts you want, but that's not you expressing love. And here they are frustrated, like, how come you don't feel my love when I'm buying you gifts every week, right? And this is just a cycle we see happen with relationships. There's books, there's quizzes, there's even an app. I love the app because if you and your partner take the quiz on there, you can actually set it up that the person gets text message reminders of how to express love to that person based on their language. So especially for people who are going to forget or, not make this a priority, the text messages are always great. And the final thing I close with is communication is key. So the healthiest sexual relationship comes with communication, what you need, what you like, what you want to try. The people that are having really amazing sex out there, this is a key to it. They're not ashamed. They don't hide what they like and what they don't like, and what they really want to explore. I guarantee your partner would rather have this conversation than complete silence about the topic. Cancer can make your partner withdraw. And we talked about this. And so it's sometimes up to you to be the one to initiate these things. Expect grief, anxiety, relearning around this whole thing. We're also dynamic beings that we grow and we change over time from our experiences, from age. And so maybe who you were 5 years ago, 10 years ago is not who you are now. There's nothing to be ashamed of. We grow and we change. And so our wants, our desires, our needs change over time. And we all just need to acknowledge that, but also communicate that, right? And then just core communication strategies are really critical. So one way of saying, like, I really miss our sex life. Let's talk about what's getting in the way of our being close versus you never touch me anymore, right? It's how you approach communication that can really facilitate and open the door to that. You have a team of people around you. I've heard multiple times, my doctor never talked about this. My doctor didn't say this to me. Know that your doctor is out to save your life. And they're really good at that, right? And that's their focus and that's their role. And maybe they mentioned this in passing, but you have a whole team of people that are ready and willing to talk about this topic to support you through it, whether it's psychology, clinical social work, couples therapy, OT, PT. These people exist. They're out there in the community. They're connected to your facilities. Please tap into it because, again, you cannot do this alone. It is enormous, the journey that you've been through, the battle you've been through, the experiences you've been through, and it takes a team of people. I always end with some joke because just to lighten things up, because I hear all the time, if I hear one more time that I look fine and that I didn't go through, how could I have gone through cancer, that I might hurt someone. So this is just a final joke, but I will stop so that I can take questions, concerns, curiosities.
Sherry, first of all, thank you so much. That was such a holistic approach to your presentation. It was psychosocial, it was relational. I love that nudge app. That's fantastic. I wrote that down. Thank you so much for this presentation. It was packed with information. It was so helpful. I'm going to go ahead and stop the recording and then we can open up to questions for a few minutes.
Definitely.